Cardiovascular Drugs Pharmacology MCQ, 15 must-know questions with rationales. Question 1. A patient is taking digoxin and furosemide, Lasix. They report nausea and seeing yellow halos around lights. The nurse sees a U wave on the telemetry monitor. What is the priority lab value? Option A, BNP. Option B, serum potassium. Option C, digoxin level. Option D, creatinine. The correct answer is option B, serum potassium. Furosemide wastes potassium. Low potassium makes digoxin toxic even if the digoxin level is normal. You verify K+ before drawing the dig level. Question 2. A LPN is caring for a patient on a nifedipine, calcium channel blocker. Which assessment finding requires the LPN to report to the RN immediately? Option A, ankle swelling, 2+ pitting edema. Option B, flushing and headache. Option C, heart rate of 54 and BP 88/50ths. Option D, constipation for 2 days. The correct answer is option C, heart rate of 54 and BP 88/50ths. Ankle swelling, A, flushing, B, and constipation, D, are expected side effects of nifedipine. Hypotension with bradycardia is a toxic effect requiring the RN to hold the drug. Question 3. Which patient is most at risk for developing heparin-induced thrombocytopenia, HIT? Option A, patient on subcutaneous heparin for a flight. Option B, patient on 4-heparin for DVT for 5 days. Option C, patient on enoxaparin post-op knee surgery. Option D, patient on warfarin for chronic AFib. The correct answer is option B, patient on 4-heparin for DVT for 5 days. HIT most commonly develops after several days of continuous 4-heparin therapy. Patients on 4-heparin for 5 days are at the highest risk. Question 4. A patient on metoprolol for heart failure has a heart rate of 52 and blood pressure of 90/60. The LPN holds the medication and calls the RN. But here is the twist. The RN says give it anyway. Why would an RN override a low heart rate? Option A. The patient has a history of atrial fibrillation with rapid rate. Option B. The patient is scheduled for a stress test today. Option C. The medication is a beta blocker and the goal is a heart rate under 70. Option D. The patient's blood pressure is actually high for them. The correct answer is option C. The medication is a beta blocker and the goal is a heart rate under 70. The goal is a heart rate under 70. In heart failure, beta blockers like metoprolol are given to slow the heart on purpose. A heart rate of 52 is therapeutic, not toxic if the patient is stable and asymptomatic. Holding it would worsen heart failure over time. The RN knows this. The LPN learns this. Question 5. You are caring for 2 patients. One on heparin drip, one on enoxaparin injections. Both have a platelet count drop from 250 to 80 over 4 days. Which patient is in danger of a deadly blood clot? Option A. The patient on heparin. Option B. The patient on enoxaparin. Option C. Both are at equal risk. Option D. Neither. Platelets are not related to these drugs. The correct answer is option A. The patient on heparin. The patient on heparin. This is heparin-induced thrombocytopenia or HIT. It is rare with enoxaparin. HIT is a paradox. The platelet count goes down but the risk of blood clots goes up. The patient on heparin needs the drip stopped immediately and switched to a non-heparin drug like argatroban. Do not give more platelets. That makes it worse. Question 6. A new nurse gives amiodarone 4-push over 30 seconds. The patient immediately crashes into cardiac arrest. What did the nurse do wrong? Option A. Amiodarone cannot be given 4-push. Option B. The dose was too high for the patient's weight. Option C. Amiodarone causes sudden hypokalemia. Option D. The nurse pushed it too fast and caused hypotension. The correct answer is option D. The nurse pushed it too fast and caused hypotension. The nurse pushed it too fast. Amiodarone is a vasodilator. When given 4-push too quickly, it drops blood pressure instantly. For cardiac arrest, a fast push is allowed, but for stable arrhythmias, it must be infused over 10 to 20 minutes. Speed kills here, literally. Question 7. You have a patient on lisinopril for high blood pressure. They start a new over-the-counter pain reliever. 3 days later their blood pressure shoots up to 190/100. What pain reliever did they take? Option A. Acetaminophen. Option B. Ibuprofen. Option C. Aspirin. Option D. Naproxen. The correct answer is option B, ibuprofen. Ibuprofen. NSAIDs like ibuprofen and naproxen block the prostaglandins that help ACE inhibitors work. The result is fluid retention and loss of blood pressure control. Acetaminophen is safe. Aspirin at low dose is usually fine, but high dose can also interfere. The patient did not know their ibuprofen was canceling out their lisinopril. Question 8. A patient taking digoxin has a potassium level of 3.1 milliequivalent/L. Which cardiac rhythm change would the nurse expect to see on telemetry? Option A, sinus bradycardia with a rate of 58. Option B, premature ventricular complexes occurring in pairs. Option C, first-degree AV block with PR interval of 0.24 seconds. Option D, atrial fibrillation with controlled rate. The correct answer is option B, premature ventricular complexes occurring in pairs. Hypokalemia potentiates digoxin toxicity. The earliest and most specific sign of digoxin toxicity on telemetry is increased ectopy, including paired PVCs, bigeminy and trigeminy. Sinus bradycardia and first-degree AV block can occur but are less specific and also seen with therapeutic digoxin levels. Question 9. A patient is started on lisinopril for heart failure. Which adverse effect requires immediate discontinuation of the medication? Option A, dry cough that worsens at night. Option B, serum potassium of 4.8 milliequivalent/L. Option C, swelling of the lips and tongue. Option D, dizziness when standing up quickly. The correct answer is option C, swelling of the lips and tongue. Angioedema or swelling of the lips, tongue, or airway is a life-threatening allergic reaction to ACE inhibitors. The drug must be stopped permanently. Dry cough is common but not dangerous. Potassium of 4.8 is within normal range. Dizziness is expected due to vasodilation. Question 10. A patient on heparin infusion has a PTT of 110 seconds. The patient is not bleeding. What is the correct nursing action? Option A, stop the heparin drip immediately. Option B, continue the drip at the same rate. Option C, decrease the drip by 50%. Option D, administer protamine sulfate now. The correct answer is option A, stop the heparin drip immediately. Therapeutic PTT for heparin is typically 60 to 80 seconds depending on the lab. A PTT of 110 seconds is supertherapeutic and increases bleeding risk even without active bleeding. The drip must be stopped. Protamine is given only for active bleeding, not for high PTT alone. Question 11. A patient with atrial fibrillation takes apazaban or Eliquis. Which statement by the patient indicates a need for further teaching? Option A, I will throw away any missed doses and take the next one on time. Option B, I need to get my INR checked every month at the lab. Option C, I should watch for black tarry stools or blood in my urine. Option D, I will tell my dentist I am on a blood thinner. The correct answer is option B, I need to get my INR checked every month at the lab. Apazaban is a direct oral anticoagulant or DOAC. It does not require routine INR monitoring. That is required for warfarin only. The other statements are correct. Missed doses should not be doubled. Bleeding signs must be reported. All providers, including dentists, must know the patient is on anticoagulation. Question 12. A patient on nitroglycerin transdermal patch for angina asks why the patch is removed for 8 to 12 hours every night. What is the best response? Option A, your heart needs a break from the medication while you sleep. Option B, the patch causes dangerous low blood pressure if left on all night. Option C, removing the patch prevents tolerance from developing. Option D, the medication only works during waking hours when you are active. The correct answer is option C, removing the patch prevents tolerance from developing. Continuous nitrate exposure causes tolerance, meaning the drug stops working to prevent angina. A daily nitrate-free interval of 8 to 12 hours restores sensitivity. The patch is removed at night when the patient is resting and less likely to need anti-anginal effect. Question 13. A patient with heart failure and reduced ejection fraction is admitted with fatigue and mild shortness of breath. Home medications include metoprolol succinate 200 mg daily, lisinopril 20 mg daily, and furosemide 40 mg daily. On day 2 of hospitalization, the patient develops bradycardia with a heart rate of 48 and blood pressure of 88/52. The provider orders a decrease of metoprolol to 100 mg daily. The nurse notices the patient also has crackles halfway up both lung fields and a weight gain of 3 pounds since admission. What is the nurse's priority action? Option A, give the reduced metoprolol dose as ordered. Option B, hold the metoprolol and contact the provider again. Option C, increase the furosemide to 80 mg without an order. Option D, check a troponin level to rule out myocardial infarction. The correct answer is option B, hold the metoprolol and contact the provider again. The patient has evidence of worsening heart failure shown by crackles and weight gain. Reducing metoprolol in decompensated heart failure is dangerous because beta blockers improve survival but can unmask fluid overload when the heart rate slows too much. The bradycardia and hypotension here are caused by worsening pump failure, not just the medication. The provider needs to address fluid overload first. Question 14. A patient is brought to the emergency department after taking an unknown amount of verapamil extended-release tablets 2 hours ago. The patient is drowsy with a heart rate of 38, blood pressure 70/40, and a prolonged PR interval on the monitor. The nurse administers intravenous calcium chloride as ordered. 15 minutes later there is no improvement. What is the next intervention the nurse should anticipate? Option A, repeat the calcium chloride dose. Option B, start a dopamine infusion. Option C, prepare for transvenous pacing. Option D, administer intravenous fat emulsion therapy. The correct answer is option D, administer intravenous fat emulsion therapy. Verapamil is a calcium channel blocker. Calcium chloride is first-line antidote, but extended-release overdoses often require lipid emulsion therapy, which acts as a lipid sink to remove drug from circulation. Question 15. A patient with chronic kidney disease stage 4 is started on carvedilol for heart failure. 3 days later the patient reports feeling tired and lightheaded. Blood pressure is 102/58, heart rate 64. The patient's baseline blood pressure before carvedilol was 140/80. The nurse reviews the lab work and notes a potassium of 4.2 and creatinine of 3.1, which is stable. What is the most likely explanation for the patient's symptoms? Option A, carvedilol is causing first-dose hypotension. Option B, the patient is developing cardiogenic shock. Option C, carvedilol has unmasked underlying adrenal insufficiency. Option D, the dose is too high for a patient with kidney disease. The correct answer is option C, carvedilol has unmasked underlying adrenal insufficiency. Carvedilol can unmask underlying adrenal insufficiency in CKD patients with reduced renin-aldosterone activity, leading to inability to maintain blood pressure despite stable labs. Question 16. A patient on warfarin for a mechanical mitral valve has an INR of 1.8. The target INR for this patient is 2.5 to 3.5. The patient has no bleeding. The nurse calls the provider, who orders a one-time increase of warfarin from 5 mg to 7 mg tonight and repeat INR in the morning. The patient also takes amiodarone 200 mg daily for atrial fibrillation. What is the nurse's best action? Option A, give the 7 mg of warfarin as ordered and repeat INR in the morning. Option B, give the usual 5 mg of warfarin and document the provider order. Option C, hold the warfarin completely and request a stat INR. Option D, contact the provider again because amiodarone will increase the INR unpredictably. The correct answer is option D, contact the provider again because amiodarone will increase the INR unpredictably. Amiodarone inhibits warfarin metabolism via CYP2C9, making INR increases unpredictable and potentially dangerous if dose is increased aggressively. Question 17. A patient with hypertension is prescribed hydrochlorothiazide 25 mg daily. The patient also takes lithium for bipolar disorder. 1 week later the patient's family reports confusion, slurred speech, and hand tremors. The patient's lithium level was 0.8 milliequivalent/L 1 month ago. What is the most likely cause? Option A, hydrochlorothiazide has caused lithium toxicity. Option B, the patient has developed serotonin syndrome. Option C, hydrochlorothiazide has unmasked Parkinson's disease. Option D, the patient is having a bipolar manic episode. The correct answer is option A, hydrochlorothiazide has caused lithium toxicity. Thiazide diuretics reduce renal clearance of lithium, leading to toxicity even when prior levels were therapeutic. Question 18. A patient with erectile dysfunction took sildenafil 12 hours ago. The patient now presents with chest pain and is prescribed sublingual nitroglycerin. The nurse holds the nitroglycerin. How long must the nurse wait after sildenafil before nitroglycerin is considered safe? Option A 6 hours, Option B 12 hours, Option C 24 hours, Option D 48 hours. The correct answer is Option C, 24 hours. Sildenafil potentiates nitrates causing severe hypotension. Nitrates are safe only after 24 hours, 48 hours for tadalafil.